For this case, I'm very interested because it's related to women. Can you have a look and tell me a little bit about this condition?
Yes, this is a case of a 50-year-old woman who's got severe psoriasis on the legs and the arms. And she's had psoriasis for many, many years, over 40 years, she tells us. And of course, we know we want to do our best to help her.
Can you tell me a little bit more about that psoriasis?
Yes, psoriasis is genetic. It stays in your system for many, many years. Sometimes you don't even know you have it until it gets triggered. And then once it's triggered, her skin obviously started flaring up. And then over the years, she tells us it's got worse and worse and worse.
That's called the flare-up.
Yeah, it's flared up badly. Her skin, we understand, it's flared up because of stress. She has a problem at home. There's family issues at home. Her work is very stressful. She works very long hours. And there's a lot of demands from, for her.
From others.
From others demanding her time.
Yes.
Plus she's got work, plus she's got her own children, plus she's got her parents also to care for.
Especially if the woman, if they're pregnant and they have the psoriasis, can you give some advice for them?
Yes, with women who are pregnant, it's difficult because, with psoriasis, there are many triggers. So we've got to be very careful when they're pregnant that they don't do anything to affect the baby. So it's important that, they don't smoke, for example. They don't drink a lot of alcohol because the alcohol and the smoking will affect their psoriasis anyway. But on top of that, it has an impact on the baby. So my advice to women who are pregnant is, especially if they've got a skin problem, is to, keep away from drugs, keep away from alcohol, keep away from, smoking as best as possible.
But when during pregnancy, if they have the psoriasis, that affect baby when they was born?
It can affect the baby if you are drinking and having a lot of alcohol, and also if you are smoking a lot or you're taking a lot of other chemicals. And the stress also can play a role on the baby. Now, it doesn't mean that the baby will be born with psoriasis because we don't know yet. But if the mother has psoriasis, there's a higher chance that the baby can have psoriasis.
That's important. That's important. This is my concern as well. Back to this case, can you say that what treatment she used before?
Yes, she's tried many different treatments. She's tried a lot of medical treatments, obviously, like methotrexate, cyclosporine, or all the systemic drugs. And she's also tried a lot of topical agents, which she's had some improvement. And I also understand that she even tried light treatment, which gave her some benefit. But all these things are temporary unless you address triggers that are flaring up your skin. Now, this lady, interestingly also, she's going through menopause. In menopause, there are changes in the hormones. And obviously, hormonal changes can also impact on the psoriasis.
I see that. How about the pregnant? When they're pregnant, is there any treatment for them? Because I know that when you're pregnant, you cannot take any tablet.
Yes. So with treatments for pregnant women, we normally recommend use herbal medications as much as possible, or herbal creams and ointments. Like our ointments contain a lot of herbal bioactives. So they're very safe because there's been trial done in Europe. But we don't like to give women any oral medications to take while they're pregnant. So it's important that you look at all these different treatments. But UV light has been found to be very useful. So during pregnancy, they can use a little bit of UV light that can help, keeping in mind that sunshine helps.
So, of course, the UV light does not affect the baby, isn't it?
As long as you don't overdo it.
Okay. Can you tell me, what treatment you give for the lady?
So with this lady, because obviously she's very stressed, so firstly we need to look at how we can help her manage her stress. We got her to do some exercise, which she didn't like to do because she told us that she has no time to do exercise because she's got so many things she's doing. So we encouraged her as much as possible to do some exercise, do something that make her happy. But again, she tells us that it's important for her to look after her family, but not for herself.
Yeah.
My expression to them is always, it's most important that you do something to help yourself first,
Yes.
and then you can help your family. If you can't help yourself and you're not well yourself, how can you help your family?
90% women always like that.
Yeah, women are like that. It's like they feel obligated
Yes,
to
yes.
help.
Yeah, they do a lot of things. A lot of things after work.
Yeah,
This is
but
a good
we
advice.
gave her the treatment that we gave her, special ointment that we use. We gave her some tablets to take and to manage her stress. And also we got her to look at her hormones, to see her doctor about hormonal changes and how the doctor can help her with that, with HRT and things like that. Yeah. And after a period of about 2 months, she had enormous benefits. Her skin is cleared up a lot, so she's got good improvements. But again, we want her to maintain the improvement. And to maintain the improvement, she must look at how to address those triggers.
Yes, of course. Especially for this case, I hope all of the women, if you have the psoriasis, you have to remember you need to take care about yourself first to improve the conditions, and after that, you will bring back the happy to your life. Thank you, Professor.
It's a pleasure. Thank you.